In Fox 5 Health News, the CDC says cold and flu season has yet to peak, and experts fear the worst is yet to come.
All right, joining us now, Dr. Serge Sugger, Chief of Infectious Diseases at Holy Name. All right, let's talk about what exactly is driving this season's virus activity thus far.
Sure. So, hi, Steve and Tasha. Thanks so much for having me. This is not unexpected, right? We knew that the season starts with the colder weather, congregation indoors, typically after Thanksgiving, and ending and going all throughout Christmas, Hanukkah, and New Year's as people congregate together in the cold weather. So this is something that we have to prepare for. I think the only difference now is that we now, in addition to the typical viruses, we now have COVID-19 that we're now dealing with almost in its fourth year, unbelievably, that has now become endemic and seasonal. And so between influenza, which usually peaks in February, RSV, which may be peaking already, and COVID-19, which currently still is the highest percentage of hospitalizations of those three viruses, this is something that the general public, us in the healthcare community, are going to have to continue to deal with. The good news, of course, is that we are not in the same situation we were before. We have indeed vaccines for all three. Now, unfortunately, the uptake for both influenza and this year's COVID-19 has been somewhat disappointing as of late. So I think we need to remind people that this is our best bet for preventing infection, severe disease, and people as they go together and get together with their families for the holidays. They don't want to be known as the Grinch that brought COVID-19 or RSV or any other types of viruses to the family get together. So I think people really need to take stock of their risk factors, take a look at their family members, their social bubbles, and really make sure that they do all aspects to take care of themselves, whether it's getting the vaccine, it's staying home when sick, social mitigation if sick, covering, of course, personal hygiene, coughing and sneezing, covering yourself. These are things that we can all do, as we really have to live with this every year, really, in the Northern Hemisphere.
Makes sense, yeah.
November, December, sure.
All right, well, here's a sort of interesting issue you're seeing in the news more. Non-smokers being diagnosed with lung cancer. Big Bang Theory stars Kate Micucci's recent diagnosis is raising this question once again. How can people who didn't smoke be diagnosed with lung cancer?
Yeah, so let's just reiterate the overwhelming and most preventable way for not getting lung cancer is by not smoking in the first place. By far and wide, that's the most common risk factor. However, 20% of the time, 10 to 20% of the time, you can have lung cancer in people who are not smokers. And why is that? Well, that can be secondhand exposure. That can be occupational exposure. Think like people who are working in factories with asbestos, et cetera, radon, other occupational air pollutants, and sometimes just what we call spontaneous genetic mutations. So I think we need, this is a case where someone was very public, and that's very thankful for that because it's bringing awareness to the situation that yes, smoking is still the #1 identifiable risk factor that you can modify, but it's not the absolute and only risk factor. So I think if people have a family history of lung cancer, if they have in certain occupations or certain environmental exposures that may be concerning, they should talk to their doctor about different screening processes.
Yeah, so what are some of the symptoms that we should be on the lookout for?
Yeah, great question. So oftentimes we tell med students that the #1 is a chronic cough that's progressive in nature, shortness of breath. This is not something that you felt fine on Monday and Tuesday, all of a sudden you have symptoms. This is a gradual, progressive nature, sometimes culminating in what we call hemoptysis, or fancy word for coughing out blood, unintentional weight loss, feeling tired. So of all of these things, people know their body. If they have these symptoms that are chronically and lingering and continuing and progressing in nature, they should really talk to their primary care physician about getting screened and ascertaining what are the risk factors, if any, so then they can go on and in this case get diagnosed, if being diagnosed early, and what sounds without personal knowledge, curative.
Right, very important conversation. Dr. Serge Sugger, thank you so much for your time.
Thanks for having me.
Well,